typically the same time each year. What we try to do is provide you with the latest updates of Torrance Memorial IPA that we feel would be helpful to you and your clients when you're sitting, across the table or on the phone with a client or a potential new client. We structure this presentation so we feel like it's helpful for you, not just for us to be up here as some talking heads. So I want to thank all of you for attending today. We know this is an extremely busy time of year, to say the least. A few things that I do want to call out this afternoon before I introduce myself and the other speakers here that you may already know. But we really look to each and every one of you as an extension of the IPA. As you know, Torrance Memorial IPA is a regional IPA serving the South Bay, and if you're newer to the to Torrance Memorial IPA, you'll get a good introduction to it this morning. But you really are the advocates out there. You're an extension of IPA. You're the usually the first ones that are in front of a potential member for Torrance Memorial and the IPA, and it's extremely important that we give you the tools and the knowledge to help you feel confident about enrolling your clients with us. So just want to express our thanks to all of you and for taking time out of your day to do that. And we know that we know that we've seen a lot of data, a lot of research that shows that if we can bring a new member into the IPA by way of an agent like yourself, we see better retention rates. So we know that's hopefully a win-win for both us and you alike. And if you have place your client with a strong medical group like ours, hopefully that means retention for you as well and better client satisfaction. So with that, I do want to introduce myself. If you don't know me, I'll start with myself and then our other speakers here. I'm Eric Milanez. I'm the marketing manager here at Torrance Memorial IPA. I've been here for about 5 years now, so it's been an awesome ride. I've had the opportunity to work with probably the majority of everyone that I see, so many familiar names in the participant list. So it's just been such an honor to work with all of you and for the IPA and really deliver just a great healthcare experience for your clients. So it's been a great experience here. We'll also have Dr. Panich, who many of you know, who's one of the original founders of Torrance Memorial IPA. So he'll give you a little bit of history about the IPA, but also some of the new things and background of the IPA, like case management. We're more than just a physician network, right? We have great doctors and specialists and so forth, but there's a lot of other aspects to what the IPA offers. So Dr. Panich is going to delve into that. And we also have Aaron Fiorito, who's our Executive Director of Marketing Communication and of Health Education for Torrance Memorial Health. And Aaron's going to really provide some insight into other aspects of the health system, the different institutes that your clients will have access to when it comes to orthopedic care, cardiologists, and so forth. We have some amazing services that your clients can access by way of the overall health system by being a member of Torrance Memorial IPA. So without further ado, I'll go ahead and pass the baton over to you, Dr. Panich, and feel free to provide an overview of the IPA difference.
Well, thank you. When I first came here in 1975 from Harbor General, it was a tiny little hospital. The new wing obviously wasn't here, and we called the IPA FIPA, which most of us still call FIPA, Torrance Hospital IPA. It took me a couple of years to get to Torrance Memorial IPA, but we wanted to have more of an association with the hospital. So we were independent until about 10 years ago when Craig Leach, the CEO, who happens to be retiring, I think next month, or I think Halloween, he called me up and he said, we want to buy the IPA. We had asked them for years to buy the IPA because we knew how complex an IPA could be, and we needed strong background. So I started it with Dr. Stewart, who's now deceased. He was a surgeon, and we started it, and it was really rough. Nobody wanted to do HMO medicine, and we had to really twist arms to get a little panel together. And at first the primaries were capitated, and the specialists were fee for service, and then we changed it around 100%. Now the primaries are fee for service, and the specialists are capitated. So it's been an interesting ride since 1980 when I started this, and to watch the IPA grow is just been so satisfying to me. I told somebody the other day I've spent half my life, more than half my life, with Torrance Memorial IPA, so I'm quite devoted. So in general, we're not for profit. We're not on the stock market. We're not for profit. We're a multi-specialty network. We're a division now of Torrance Memorial Medical Center or Health, and we've been here for more than 40 years. And there's a little cross-section of some of our outstanding physicians. The Hoffman Conference Center, that in the center is Heidi, who's the daughter of Dr. Richard Hoffman, who we named the center after, and she's just an incredible radiologist. Next slide, please. By the way, Torrance Memorial Radiology Department is probably, I would say, the most outstanding radiology department in the Southland. All of them, virtually all of them, have come from UCLA, and they all have different specialties. So our radiology department is just out of sight. And we have over 500 physicians now. I think I started with 8. We got 52 family doctors. We have internists. We're loaded with pediatricians. We have a lot of commercial. And we have, we emphasize our seniors. And we have 141 in primary care, 27 GYN, and over 400 specialists. And virtually, you name the specialty, we have the doctor. Next slide, please. So here's kind of an overview of where we are. We're in the South Bay. You could see the lowest blue little doodad, and that's where most of our patients come from, Torrance, Lomita. And then we moved eastward to Carson, and we have a very strong presence in Carson with bilingual physicians. And then you move up the coast, we have doctors on Pier Avenue. We have a beautiful facility on Pier Avenue with primary care doctors. And I was driving there the other day and I saw an urgent care sign. So I guess they're doing urgent care as well in Redondo Beach or Hermosa Beach. And then we have another beautiful facility in Manhattan Beach, which is a urgent care center. That seems to be the thing now. You drive around. I mean, I know that our urgent care centers are staffed by our emergency room doctors. I see all of these urgent care centers going up. I didn't even know who the doctors are, what the hospital is. They just put a sign up, urgent care. Most of them are empty. And then if you move up, I'm sure Erin will speak to our new El Segundo location, which really is a mini hospital. I mean, she'll show you that we can do virtually everything there, including GI, which is my specialty, upper endoscopy and colonoscopy and imaging. It is an incredible addition to the El Segundo area, right off the 405. And I don't think we'll go any higher because, as you know, we're affiliated with Cedars, and I think they get a lot of patients from Marina del Rey. So I don't think we'll go any higher than El Segundo or the airport. So we've expanded our orthopedic surgery. You know, everything's done now with the robot, and it's done as an outpatient. And it's just an incredible field now. We've expanded cardiology. We brought down from Cedars some of their outstanding cardiac surgeons, really the best in the city. So our patients don't have to go fight the 405 to get to Cedars to have their cardiology procedures done. And Aaron will get into the numbers of the cardiology outcomes. We have terrific outcomes. We also have palliative care, which is a new specialty, which is the care before hospice. These are patients who are very sick, usually have cancer or lung disease or heart disease, and they really need someone to help them closely. And that's our palliative care. And not all of those patients go into hospice. A lot of them get better and they go back to normal lives. We're excellent. We're loaded with pain management. That's basically a new field. They do all of the injections into hips, into knees. They help with opioid problems. So pain management is important. We expanded family medicine, which I think Eric will talk about. We're getting more and more young, smart, devoted physicians, and that's what we want. Because we started in 1980. A lot of doctors are, retiring now. These single doctors, and I don't think a single doctor coming out into the community can survive. No way. We're very strong in family medicine, internal medicine, general medicine, and geriatrics. And we have a care coordination center, which includes Coumadin, the Coumadin Clinic. And these are patients who come out of the hospital who are confused about their medication, confused about what happened. And our care coordination center is devoted to these patients. It's a terrific addition to our armamentarium. Next slide, please. So what is the major difference? Well, number one, our numbers are incredible. Over 500 primary care physicians and specialists. We're not going anywhere. We've been here for 40 years, and we're part of Torrance Memorial Health Systems. And I want you to look again, convenience. I came up with this idea with the former CEO. We said, how can we differentiate ourselves? Well, we came up with member self-referral to select important specialties. And this self-referral is for all of our associated groups. All of our groups can use this. Any patient in Torrance Memorial IPA can self-refer to these specialties. It doesn't matter if you're in Aetna or you're in Scan or whether you're in Blue Shield, you can use self-referral. And at first, everybody said, no, they're going to load us up back. We're going to load us up, but it turned out to be incredibly successful. And lastly, we're now affiliated with Cedars of Sinai. And I think Aaron has a slide to show the importance of this affiliation. Next slide, please. So I just wanted to delve a little bit into our member self-referral. We're the only medical group that offers member self-referral across all contracted health plans, not just one, all. And we have open access to these specialties, which are behavioral health. Remember, Torrance purchased that building near us, the McMillan building. Cardiology, I put first. I didn't want anybody walking around with chest pain or shortness of breath. Somebody is, I always say, walking up a hill or riding a bike and gets a little chest pain. We want them to call the cardiologist and say, I'll just pick one. I'm Aetna, I'm Aetna FIPA. And you get in as if you're a PPO, get right in to the cardiologist. Same with dermatology. You see a funny black lesion on your arm, you're scared, you think you have a melanoma. We have a very, very large dermatology group. Being a former gastroenterologist, that was the first group that accepted member self-referral. Well, we had to accept it because I was running the practice. So you can call up and schedule your colonoscopy, or if you're having heartburn, upper endoscopy. So GI is member self-referral. OBGYN, self-referral. Podiatry, why did I pick podiatry? Because we have so many diabetics, and we don't want those diabetics getting foot ulcers and coming into the hospital. Pulmonology, again, we're seeing another surge in COVID. Somebody coughs up a little blood or gets shortness of breath, they can call up our pulmonologists and member self-referral. Same in urology, we have two major groups. You can self-referral. And lastly, we have something called case management. This is a group of providers who take care of our members with chronic health conditions. They may do it by phone, they may go to the house, they may go to the doctor's office with them. And I always say, what's the most important thing on an office visit? To have somebody with you who can explain what the doctor said. You know how fast the doctors are now, and they're in and out. We don't want that. We want somebody coming with the patient to explain to them what the doctor has said. That's case management, very important. Next slide, please. So here's our cardiology network. It's gigantic. We grabbed CORE, which was the outstanding cardiology group. They do all the electrophysiology. They do all the TAVRs, the aortic valve replacements. They are superb. We then have within the network two cardiologists and three cardiologists. And I'll just for 1 second explain within Torrance Hospital IPA, we have a network. It's like a mini Kaiser. And this is where all the young doctors are going. They're salaried, they're monitored, and they're in the network. And it makes up, it started out, it was 10%. It's about 40% of Torrance Memorial IPA. And then we have independent doctors who are superb, Dr. Averill, Dr. Khalili, and Dr. Lopez. So we are loaded with cardiologists. Next slide, please. So I know a lot of members call you as their broker friend to get something done. Maybe they don't understand the bill. They probably shouldn't get it, but they don't understand the bill. They can't find a doctor. They'd like to switch a doctor. Are they eligible? What's my authorization status? So they may call you, but they can call us. And we have human beings, not robots, human beings answering the phone in member services. And that team is just a phone call away. Very important to have member services. Next slide, please. So we have a minimum of 3 urgent care centers, one in Torrance next to the hospital, across the street from the specialty building. That's a good one. That used to be mine. I built that when we were independent. It was on Hawthorne and Sepulveda, right near the bowling alley. You know, they cleaned out that whole area. They're going to put up apartments. Like we don't have enough traffic. And then we have an urgent care in Manhattan Beach. And now we have an urgent care in El Segundo. And really, we have an urgent care in Hermosa on Pierre Avenue. And we have an urgent care in Manhattan Beach. So we are really covered with urgent care. And urgent care can immediately communicate with the emergency room and say, I got somebody here with chest pain, I'm worried. Boom, send them over. So that relationship is very, very important. So imaging is now open, if you can see at the top. That's CAT scan and ultrasound. Next slide, please. So this is my last slide. It's the circle of health. I came up with this after listening to Elton John singing the circle of life. But this is the circle of health. The member comes in, gets a primary care doctor, 2 required visits, an annual wellness visit to a provider, and then an annual wellness note by the doctor. And they do this yearly. And then we're surrounded by care management, a multitude of specialists, easy access, self-referral. We got the best hospital in the South Bay, voted by everyone. Tradition, all the major health plans of quality are accepted. We have member services, and the hospital offers discounts on all of their programs, Pilates, yoga, etc. And then we have at least 5 now urgent care centers. So if your clients are looking for, I think, the finest medical group in the South Bay, certainly in the Southland, put them with us. We have over 11,000 seniors. They love us. They love their doctors. And we offer, I think, the finest care in the South Bay. So I will stop now and turn it over to Erin Fiorito, who handles the hospital. I don't know her formal title.
That's all right.
I don't know her formal title. She does everything.
Yeah, kind of. I wear a lot of hats, for sure, for sure. Thank you,
Whatever
Dr.
they want,
Spanish.
Erin will do it.
Right.
So we get Erin in on our lectures now, and I think it's really great that she talks about the hospital and all the advances that the hospital's making. So I'll leave it to Erin.
All righty. Thank you, Dr. Panage. So Dr. Panage obviously gave a lot of an overview over Torrance IPA. And as you mentioned, you know, Torrance IPA is a division of Torrance Memorial Health. And, you know, when we look at all of our networks and we look at the IPA and then we look at the medical center, we feel that we have just a tremendous value to your clients. And I want to talk a little bit about the hospital side of it, talk a lot about the specialty care and what we're doing at that on that front. And I also want to talk a little bit about Cedars-Sinai, because we are been affiliated with them for 5 years. So I think that's our first slide, right, Eric? All right, here we go. So Torrance Memorial affiliated with Cedars-Sinai 5 years ago, and everyone always asks, what does that mean? And the affiliation is, we weren't bought out, we're still quite independent. The way I always describe it, Torrance Memorial has been an outstanding hospital, and we've been, as Dr. Panich mentioned, we've been growing and adding specialties throughout the last decade and more. But there have been areas where maybe we had gaps. So for example, neurosurgery is an area that we had some surgeons that were actually starting to retire. So it's kind of a perfect opportunity where then Cedars came in and they provided us with some of their specialists, their neurosurgeon specialists. And so it was great. So they were kind of filling in those spaces that we had gaps. Not only is it the areas that we had maybe some specialty gaps, but they also come in and help us with investing in infrastructure. For example, our El Segundo building, that was a collaboration, a financial collaboration, which allows us to expand our reach and access a little bit further north of us. And that's been tremendous to be able to continue to expand our ambulatory offices and care. Also, the other thing about this is when we think about, I think you can turn to the next slide a little bit, Eric. We can talk a little bit, next slide on this one. So what it means for the IPA, as I mentioned, we have this strong clinical partnership. I've talked about neurosurgery. This is true for cardiovascular surgery. We brought in Dr. Gale, and I'm going to talk about that program in a few minutes. Oncology is another area. So we've, again, all of these specialties were very strong to begin with. We've just added more expertise. We've added more services and treatment availability. So within oncology, now we're participating in more research. We have access to even more clinical trials. And I think where the biggest difference and where kind of the partnership really expands is when a patient needs super strong specialty care, like let's say if you have a heart failure client and unfortunately their treatment, their treatment is kind of losing its benefits and they need a heart transplant. Well, we'll pass that patient up to the transplant team up at Cedars. So they'll continue to get all their regular care locally, which again, and this is the part that I think is so critical. They can still get their care here on this campus in their neighborhood. But then for those quaternary types of care situations like a heart transplant or some other type of treatment that's not available here, that team is ready to receive that patient. They know about that patient. They're already part of their care team. And so that patient goes up there, they receive whatever that specialty care is that we aren't able to accommodate here. And then they come back to us and then they continue to get their post-treatment care often here on our campus. So when we look at the value that this affiliation brings, it's more expertise, more access to advanced care and treatments, but also then you still have the benefits of getting treated, and most likely most of your care will be here. One thing that we do want to mention when it comes to Torrance Memorial IPA, what this relationship is not, is that it is not a consolidation or combination of their network with our IPA network. We are still Torrance Memorial IPA, and those are the networks that is the network of physicians that your clients would have access to, with the exception of any event that they might need, as I mentioned, some of those quaternary care coordination. So the next slide, please. All right, so over the next few slides, I want to talk a little bit about specialty care and kind of explain to you all what your patient or what your clients can expect from Torrance Memorial. So cardiovascular care has been super strong at Torrance Memorial for many, many years, but we have actually grown significantly. Matter of fact, we are the third largest hospital cardiovascular program in Los Angeles County. We do more than UCLA. We do more than Hoag. We do so many more procedures than than some of our competitors. And what does that mean? Experience. I always give the analogy, if your pilot is flying the plane, you want that pilot to have lots and lots of hours of training, right? You don't want that person to get their license and just get behind, a giant plane. This is the same with our Cardiovascular Institute. The volume that we do equals experience and expertise. In some of these areas, for example, TAVR, which is not a new procedure, but within the last decade or so, this allows patients to have some of our valve replacement without having open heart surgery. They actually go through, they go through your vein in your arm or in your groin, and they're able to replace your artery in your heart. We've done over 800. We are the leader in TAVR procedures. Again, doing more than most of our competitors. Heart failure is another area that we've just exploded. We've treated over 1,000 heart failure patients. We've had just incredible outcomes. This is, again, largely in part with our partnership with Cedars. As I mentioned earlier, we work really closely with their heart failure team. Matter of fact, several of their heart failure physicians comes down and works with some of our advanced heart failure patients. And that's where that evaluation comes in, and whether or not that patient may need an actual maybe have a transplant, and that would be coordinated at that level. Technology is another area that we know, in order to provide the most comprehensive care and the advanced capabilities, we have to invest in technology. Torrance Memorial was the first in many of these instances. We were the first to have ECMO. You probably have heard of ECMO if you've, this is a lung machine that helps keep lung and heart machine. And basically, when all else fails and you are in complete organ failure, if you have an ECMO team, which by the way, not all hospitals have, you need expertise not only from a physician and care team, but you also need to have the technology. This is kind of what they say is sort of your last ditch effort. And during COVID, we actually used this quite a bit, because a lot of those patients came in quite sick, and their lungs were failing, and then their heart was failing. And we were able to save many lives because of having ECMO. And again, we were the only hospital in the South Bay that offered that. Impella is another great technology. This again helps support our patients who are struggling to oxygenate their blood. So this is a device that gets inserted into your heart, and again, it helps move your blood and oxygenate your blood so that you can effectively, so your heart can work more effectively. We have a brand new hospital. Hopefully you all know that, but we have a brand new hospital as of about 5, 6, 7 years ago. All of our operating rooms are hybrid. We also have actually 3 electrophysiology labs, and we're redoing, matter of fact, we just heard from a doctor last night, we're redoing our EP labs, so they'll be even more advanced and have more capabilities than they do now. And as I mentioned, we have that extended partnership with Cedars with our cardiovascular surgery program. And one thing I do want to bring up is because our program is so strong, and we have this depth of field of expertise, every month or two, I get calls from our program leaders. And even last night on my way home, I got a call from our leader, one of our surgeons, and saying, hey, by the way, we're starting this new program. It's called the Rapid Team Approach to Cardiogenic Shock. And this is for our heart failure patients. And the only reason we can bring these really advanced programs to Torrance Memorial, which again would normally only be accessible at an academic center, is because we have the team. We have the team in place that can do these procedures. We have the technology. And I always talk about there is the physicians, that's the team, but it's really a lot of the support staff that supports that technology and those programs. You can't just have a physician that knows how to do it. You need to have the team that can do it. So if you want to go to the next slide, then I can talk about what do we have next? Okay, Orthopedic Institute. This is the one where I always tell people, my friends, my family, there is no reason to go anywhere else than Torrance Memorial for your orthopedic care. We're the second largest hospital for in Los Angeles County for orthopedic care. We are 91st in the nation. We have all of these awards that demonstrate the capabilities. We have new technology. We have actually two robotic systems now. One is Mako, and the other one is called, I think, O-arm. This again is just helping our physicians, with making sure that those procedures are done even with more precision. This team is deep. We have so many great orthopedic surgeons for all parts of your body. And I always laugh at, and all of your prehab programs are available here locally. obviously your post-surgical rehab is done here. The team works really well together. There is absolutely no reason to get on the 405 to go to another hospital for any orthopedic care. All right, next slide. Dr. Andras is one of our, I would say new, but he's been with our program on the more recent level, and he has been an outstanding addition to our program. He is part of our co-management team that's really helped leading the way for Torrance Memorial's Orthopedic Institute. He is a great surgeon. He does a lot of hips and knees. He's also performing partial knee replacement surgery, and that's a great option for a lot of people. It is a way to kind of support have some, to heal, or not heal, but to treat some knee pain without having to necessarily go through a full replacement. So that's an option here that, again, isn't available to in many other places. All right, next slide. Neurosciences. Now here is the place where I feel that Cedars has had the most impact. In a couple areas specifically. We are a certified comprehensive stroke center. If you guys don't know what that means, essentially that means if you have a stroke, we have every treatment that is available to treat a stroke patient. Not all hospitals have this. Matter of fact, if you are having a stroke and you do not have the certification, like the EMTs will take you to another hospital. That's why this certification is so critical. It demonstrates that we have the most advanced capability. We have the ability to treat all types of strokes quickly, and we have reported extremely good outcomes. We've expanded neurosurgery and our neurovascular surgery program. Here too, I got an email from our director over the neurosurgery program, and we're doing now this new, it's called middle meningeal artery embolization, and this treats chronic subdural hematomas without open surgery. And this is where I was talking about earlier with cardiology. This would not happen if we didn't have this advanced team. And while this particular procedure, and Dr. Panich can tell you, because he kind of informed me about this a little bit, but what this is great about, these are people who could suffer from these hematomas. They can live with them, but they have a quality of life issue, and they might get dizzy. They might not, they might have problem with memory. Now we could have them treated here. So while they might not be life-threatening, they are harming their quality of life. And so we're so happy that we have the surgeons that can actually perform these types of procedures here locally to support those patients. Our neo-intensive care unit is one of the best. This goes to, again, with our partnership with Cedars, but also the technology that we have to service those patients. One of the things that Cedars brought to us, which has allowed us to get that stroke designation, is sadly, if anyone were to have a stroke and they come to our emergency department, we have what's called a telestroke program. Essentially what that means is you always need to have a neurologist on site within the emergency department to take on any of those cases. So what we have is actually, it's like a telemonitor that they bring in, and basically on the other side of the monitor is a neurologist from Cedars that's on call 24/7. And so when a patient comes in and they're presenting with stroke symptoms, they will bring the patient to the neurologist on, it kind of looks like a big giant laptop or iPad essentially. That neurologist will engage with that patient, and then that neurologist will work with the care team locally here in our emergency department and to assess that patient and then get them to their treatment as quick as possible. This has actually reduced our time to what we call like door to surgery, right? So our door to surgery timeline is so small, and that has reduced, complications from stroke. Oftentimes, many of our stroke patients, because we have such a short window and because we can offer all these different treatments, our patients leave with less or no deficiencies from a stroke, and that is huge. And we're so proud of our stroke program. We also have a movement disorder clinic. This too is really great to have that here locally. Technology, we've invested in some amazing technology, BrainLab, Viper rapid scan technology. It's amazing what physicians have access to in those, like I said, those hybrid operating rooms that we have in our new hospital. And then other things that we're doing in the neurosciences area is that we are participating in research as well as clinical trials. This is an area that we weren't doing necessarily before Cedars came on board, so we're happy to have that added to our program. All right, next slide. Okay, emergency department. I think, did we miss the hunt cancer? Did we miss cancer? I feel like we might have missed cancer, but I can go to this one. I'll be really quick on this one. The emergency department, if anybody has been out there and you've been watching the news, our emergency departments across the United States have seen a massive increase in volume. Ours is also seeing the same trend. So we are going to be remodeling and expanding to our emergency department. We're very excited about this. This is going to increase the number of beds that we can support patients. It's going to have a really great open concept that will help greater visibility for our staff, as well as I just saw like some new renderings. So I'm going to have to update these slides. So it really will allow our staff to be able to work more, more collaboratively, as well as have easier access to patients. We'll have glass walls for viewing, but also for privacy and security. Behavioral health rooms. We know a lot of our emergency departments support a lot of patients who have behavioral health issues. They are very disruptive patients oftentimes. So if we have a special separate area that we can use to support those patients, it really helps those who are also in that emergency department and seeking help. So it reduces noise reduction and things like that. So this expansion is going to take us quite some time. It's going to be a double decker. So this is, I think, one of two in the whole nation of having a two floors of the emergency department. So I'm going to keep moving because I'm looking at the time and I want to give Eric some time at the end. And the last thing I just want to talk about is our reputation. When I always look at this, there's a lot of rankings out there and everyone's talking about their rankings. And while I can say, yes, look how great our rankings are, and yes, they improve every year, my biggest thing is we are best in class. And what I mean by that is look where we sit, look who we sit amongst. We sit amongst the top hospitals: Cedars, UCLA, Keck, and then Torrance, and then Hoag. We are so significantly better than our other local hospital here when it comes to our rankings. And again, it's not necessarily your ranking, but who you sit with, and we sit amongst the best. All right, I think, Eric, is that my last one?
Yep, that's it, Erin.
All righty.
We did have a question. Thanks, Judy, for joining and for the question. Judy asked if is the Neuroscience Institute considered an acute rehab unit?
Okay. Yes, it's an acute rehab. It's not we have a rehab unit. I'd have to actually get back to you on that. I want to get clarity on that, because we have our neuro ICU unit, but in terms of a rehab unit, we do have a rehab unit, but I'd have to go back and see how that's if that's attached to our neuro institute. That's a very, very good question, Judy, and let me get the answer to you.
And I took that as a takeaway, and then Judy, we can follow up with you to confirm.
That's a good one. Thank you.
Yeah. Awesome. Thanks, Erin. And you're right. We need to put the Cancer Center back in there. So we don't want to forget that.
That's a good institute too.
Yeah. All right. Thanks, Erin. That's awesome. Appreciate it. Well, I know we're getting to the last 15 minutes of the presentation, so I'll go quickly. Mainly what I wanted to do is talk about some of our recent network expansions. At this point, I think you've seen a common theme that Dr. Panich and Erin both spoke to, is just how aggressively our network is expanding. And one way we did that last year was the grand opening of the El Segundo Multi-Specialty Center. So I know several of you on the call today were able to join our open house earlier this year. So that was a great event. So thank you to all those who joined. And just wanted to really, for those of you that may not be aware, remind you of all the different specialties that we have at this location. So this is really in a great area in El Segundo. It's on the corner of Nash and El Segundo Boulevard. So it's really centrally located there. Easy freeway access, close to the 405 and the 105 freeway there. But also outside of primary care and urgent care, that Dr. Panich spoke to earlier, we also have all these several specialties that rotate through. So you'll see the different logos there, the different specialties that rotate. We have GI, a GI group with digestive care consultants that's at this location. We have a lab draw station as well, endoscopy center, pediatrics, cardiology, oncology. So really, if your client goes to this location, they can get all of their health care, most likely their specialty care at this location without having to go all the way to Torrance. So this really is the model and what we're looking to do in the future by way of this El Segundo facility. We think it's just a great way to serve the community. And I think your clients will find it extremely convenient to access this location, not only in El Segundo, but the surrounding communities, you know, parts of Inglewood, Lawndale, Hawthorne, and so forth, all have good access to this location. And as we note in the upper right there, the endoscopy center and like Dr. Panich noted earlier, are now open too. So you may not see that on the sign on the building, but we did want to remind everyone that those specialties are there. And the great thing here, when you're talking about primary care, when we first opened, we had 3 primary care physicians with Dr. Cotter, Dr. Madani, and Dr. Mejia. But since then, we've now added Dr. Alvarado, who was at Carson prior. Now he's moved up to the El Segundo location. And Dr. Lynn, who is in Torrance, has just started this past month up at El Segundo as well. So we have a strong primary care physician panel there with great access. I know that's typically one of the biggest challenges when it comes to open enrollment. Who has access? When we look at appointment times, all 5 of these physicians have great access right now. And I do want to also mention that if, you know, come January, you run into any access issues with your clients with Torrance Memorial IPA physicians, please, please, please call, email, text me. A lot of you know my colleague, Linda Samoge, and now we've added Dahlia Silva to the team. All 3 of us, I'll send you our contact information after the call. So to reach out to us if you run into any access issues, but we want to preemptively mitigate that by giving you some suggestions of primary care physicians that do have good access. And a couple other updates. I did want to feature our San Pedro location. I think there's been a lot of questions about if, you know, who's in this location and where it's located. So it's off of Western. So it sits right between San Pedro and the hill right there in Rolling Hills in Rancho Palos Verdes. So it's really good location to serve both communities. And Dr. Torna is our primary care physician at this location. So if you don't know, and I see that, and a great question, Eric, do any of the PCPs at El Segundo speak Spanish? Dr. Torna does not, but office staff does. So I think what we could do is do some sort of meet and greets, or probably looking at an open house for that location, because we have other specialties at that building as well as GYN too. So it's a building that we want to feature and educate all of you on, and to get you familiar with their staff. So that's a great question, Eric. Our primary care physician doesn't. We have GYN that does, but staff that does speak Spanish is fluent in that language. So did want to feature that location. Also, a couple other newer doctors that joined within the last year. We got Dr. Kanamori. She was briefly on out on a short leave, but she's back. We've been getting great feedback from many of our members and brokers alike that we work closely with. And one thing I wanted to feature here, and you'll see this with a lot of our primary care physicians, is that they have additional training in geriatrics. So I know, Dr. Panich, that's something that you always are very big on when looking at new physicians that are looking to join our group. And you'll notice that also Dr. Kanamori is fluent in Japanese. So we're always looking at primary care physicians and specialty doctors that are fluent in other languages. Also in Torrance, we have Dr. Nita Ruhi Brohini. She's probably joined us within the last couple years, but still has great access. So she's actually fluent in Farsi, and I know that we've had some questions from even some of the agents that I see here on the call, if we have primary care physicians that are fluent in Farsi. So Dr. Brohini does fit that need, and again, has an affinity towards our senior population. So if you're looking for a female PCP for your clients in Torrance, she's a great fit. We also have Dr. Lowe, so we're kind of just going across the spectrum of different primary care physicians that speak different languages. Dr. Lowe is fluent in Mandarin, so again, that's a question that comes up quite a bit. Dr. Lowe does speak Mandarin fluently, and she has gotten such great feedback from many of our members. She's so proactive in her patients' healthcare. Especially when it comes to taking the time to just have a conversation and learn about her new patients, understand their background, their experience, and their challenges. And I know Dr. Panich mentioned this earlier, and Aaron as well, but it really is a holistic approach to patient care. It's not just treating the disease, but also understanding what the patient challenges is, not only on the physical side, but mental side as well. So Dr. Lowe is just a pleasant doctor and wonderful addition to the team. Dr. Magadam, I know many of you have clients with Dr. Magadam. He's becoming very popular, still has good access, but I would say that's going to change very quickly, probably over open enrollment. So we've gotten just, again, these are all doctors we're showcasing that we've received positive feedback from many of you on this meeting right now. So wanted to mention Dr. Magadam. We have a lot of new female PCPs that have joined. Dr. Magadam is one of our newer male PCPs that you could recommend as well. And Dr. Shin, he just joined probably within the last 5 to 6 months. Again, very popular. And we were looking to add more Korean speaking primary care physicians to our doctors. So Dr. Shin is another physician with great access that is fluent in Korean. And I'll go quickly here. Up in Hermosa, Dr. Khan, she's fluent and she's amazing. Not only in French, but Hindi and Urdu as well. So when we look at different languages, you have different options here. And Dr. Malia,
they've got like
go. And just as a reminder, we'll be sending out a list that we do each year of all the different products that we contract with, but we do contract with most of the Medicare Advantage major carriers. I did want to mention, I know we're getting close to the end here, but I did want to share, let me get real quick, our new broker portal, where you could find some really great tools that will, let me just bring this up real quick. That we really look to help you kind of facilitate and help educate your clients, right? So if you're looking for our new physician direct PDF is located on this broker portal. We just launched this about 4 or 5 months ago, but it's a one-stop shop for all the materials that you need. If you need a list of all of our doctors, we have our directory here in a PDF format. If you need a list of doctors that are associated with any of our self-referral specialties, we have that list for you in a PDF. We also have a list of our newer, just one-pager primary care physicians on why you need a PCP flyer. So you'll see, take some time to review this. I put the login credentials in the chat. You could also find it in our broker newsletter that Linda sends out on a monthly basis. And you can find all the past 6-month newsletters that has all the recent updates about our medical group in our newsletters. Newer PCPs, doctors that are coming soon. Many of you will be happy. We're adding Dr. Sirigar, who's also fluent in Spanish, to our Carson location this October. And we're actually going to be adding a second PCP there in January. So we're getting access back in Carson again. I do want to pause there, open it up. I know we're at almost the top of the hour, but I do want to open it up for questions. You have the ability to unmute yourself. And also didn't want to forget about our raffle. So I have 5 names that I pulled from the attendees here on this list. But do we have any questions for either myself, Aaron, or Dr. Panich, or any comments? I'm looking at the chat too. Everybody has the ability to unmute if you like. All right, well, if you think of any questions, let me know. I do want to call out the winners of our, we're gonna be giving away 5 $50 Amazon gift cards. So let me move to that real quick. And if you think of any questions, feel free. I think I see a couple in the messages here. All right, our first winner, and we'll email these gift cards. We're gonna do 5 gift cards, $50, is Karen Preston. So Karen, you can expect an email from us tomorrow. Congratulations. Thank you for attending. And we'll email you your gift card tomorrow. Our second winner is Rachel Boyd. Rachel, thanks for attending. We'll email you your gift card tomorrow. And drum roll for the third winner, we got Rosie Ostella. So don't worry, I shaked up the basket. Everything was fair. I just wanted, in the sake of time, I pulled these names in advance. Our fourth winner is Robert DeJola. So Robert, thank you for attending today.
Thank you very much.
Yeah, no, appreciate it. This is the least we could do. And our fifth and final winner is Matthew Addenbrook. So again, I know all of you are very busy. I just want to express our gratitude on behalf of Dr. Panich, Aaron Fiorito, myself, my colleagues Dahlia Silva, Linda Samoge. A lot of familiar names on this list, but can't thank you enough for being such great advocates for the IPA, for your TMIPA clients. And if you have any questions at all, let me put up my email real quick. Feel free to shoot me an email. If you're not on our distribution list for our newsletter, send me an email. If you have any questions, concerns, complaints, I take all of them. So we're always open to feedback, and just appreciate everyone's time today. Thanks again, and we'll be talking soon, hopefully. All right, have a wonderful day.